pain while passing stools? Have you ever noticed blood in your toilet or your toilet paper? You might be suffering from hemorrhoids or piles, a condition that millions of Indians are suffering from but hesitate to talk about. Hi, I'm Dr. Meekala Bharat, General Surgeon, Zymus Hospital, Bangalore. In this video, we'll break down everything you need to know about piles or hemorrhoids. How to identify it, why does it happen, how does it happen, and then how can it be treated, and what happens if it's not treated. How to identify piles. Piles are swollen veins in the rectum and the anus, and this is how you can identify them. Pain while passing stools. You can feel a sharp pain or burning sensation while passing your bowel movements. Bleeding during bowel movements. You can see bright red blood in your toilet paper or in your toilet after passing your stools. Swelling or lump near your anus. You can feel a small protrusion coming out of your anal opening, itching or irritation near your anal opening, which can cause continuous discomfort. There can be mucus discharge. Some people notice a sticky white discharge that can be very uncomfortable. Feeling of incomplete bowel movements even after passing stools. There can be fullness in your anus or the urge to go even more. A 30-year-old software engineer sees blood in his commode and ignores it for a while. Gradually, the swelling becomes more swollen and painful. He thinks it's just temporary, but gradually there is pain and swelling in the anal region. Causes of piles. Piles can occur because of various reasons, including chronic constipation. Straining too hard while passing stools puts pressure on the veins. Sitting for long hours, such as office workers, drivers, and students, are at higher risk. Low fiber diet. Eating too much junk food and not enough fiber in your diet causes chronic constipation. Obesity, excessive body weight increases pressure in your lower abdomen. Pregnancy also increases pressure in your lower abdominal veins. Heavy weightlifting also increases pressure in your lower abdomen. Stages and severity in hemorrhoids. Piles or hemorrhoids can be classified into 4 grades. Grade 1 is mild piles. There is no visible lumps, but the swelling is internal and causes discomfort. Grade 2 is moderate piles where the swelling comes out while passing stools and gets back inside on its own. Grade 3 is severe piles when the swelling comes out while passing stools, but you'll have to push it inside on your own. Grade 4 is very severe piles where a very large swollen lump is outside your anus and is a very painful condition. The good news is piles is treatable, and the treatment depends on the severity of the condition. For mild cases of grade 1 and grade 2, increasing fiber intake by eating more vegetables, fruits, and whole grains, taking in a lot of water, avoid straining. Do not push too hard while passing stools. Sitting in warm water for 5 to 10 minutes can relieve your pain. Applying ointments and creams to reduce the itching and swelling. For moderate cases of grade 2 and grade 3, medications prescribed by doctors for painkillers and stool softeners, rubber band ligation. A small rubber band is placed around the pile to cut off the blood circulation and it naturally to fall off. Sclerotherapy, a special injection, is given to shrink the piles. For severe cases with chronic piles and grade 4 piles, laser treatment is used, a modern painless method to reduce the pile size. Stapler surgery, a minimally invasive surgery to remove the piles permanently. Traditional surgery called the hemorrhoidectomy is used to remove the piles completely in extreme cases. Why should you see a doctor first? A doctor can identify whether you have piles or any other anal conditions such as fistulas or fissures. A doctor can suggest the right treatment based on the severity of your condition. A doctor can prevent long-term complications such as chronic bleeding and infections. What happens if you ignore piles? Ignoring piles can cause chronic pain and discomfort, which makes your everyday activities difficult. Severe bleeding and anemia. Continuous bleeding can cause fatigue and weakness. Infections and abscess formation. Long-standing piles can lead to pus formation and infections. Thrombosed hemorrhoids. It's a condition where blood clots can cause in these dilated veins, causing it to be very painful. Piles are very common and 100% treatable. Don't hesitate to talk about it and seek help. Simple lifestyle changes can prevent this condition and sometimes cure the mild cases completely, while advanced medical treatments ensure painless recoveries. Consult your healthcare professional right now for the right treatment.